Hi, Jeremy.
Hi.
Today we're going to be doing a cranial nerve exam on you. I'm just going to be taking a look at some of the functionality in the head, the neck, some of the neurological functionality, and making sure everything's okay today. Does that sound fine?
Sounds great.
Perfect. Can you confirm your name and date of birth for me?
Jeremy 1-1.
Okay, and that is what I have here, so we'll go ahead and proceed with the examination. To start out, I'm going to ask you a couple of questions. I just want to get a sense of neurologically how everything's functioning, how your memory is working. So can you tell me what you had for lunch today?
A sandwich.
Sandwich, okay. And can you tell me the town that you were born in?
I actually can't remember.
Can't remember. Okay, no problem. Just make a note of that. And tell me a little bit about how the weather is today outside.
It's okay.
Is it sunny? Is it raining?
It's like partly cloudy.
Partly cloudy. Okay, and what about the temperature?
It's in the mid-60s.
Okay. Can you tell me about what time of day it is right now?
It's in the evening.
Okay. And if I were to say, ask you for the time, where would you look? Like if I said, what time is it? Where would you look to tell me that?
On my phone.
Okay. And what if you were wearing a watch? How would you look at that? That. Okay. And hold that up again. Can you point where on your wrist the 12 mark would be? On the 12 number on the watch itself?
Probably here.
Okay. And what about the 3?
I'm not sure.
Okay. No problem. It's just a couple of those neurological deficits. I'm going to give you a couple of words to remember, and I just want you to repeat after me right now, and then I'll ask you again in a couple of minutes, okay? So, dog, pillow, and plant. Those are all things in this room, so I want you to point at them and repeat what I just said.
Dog, pillow, and plant.
Okay, wonderful. In the meantime, I'm going to have you just draw a couple of things on my tablet here. Just get a fresh page here. So I'll give that to you. I want to see how you just write your first name, please. Okay, and can you draw something that has more than 3 sides, a shape that has more than 3 sides? Okay, anything that has more than that?
I'm not sure.
Can't think of anything?
Mm-mm.
Okay, no problem. So again, just a few mild deficits there. If I were to say it's raining cats and dogs, what does that phrase mean to you?
That means that it's raining a lot outside.
Okay, very good. And if you saw a little child crying in the street, what would you do?
Probably help them.
Okay, and what would you do to help them?
I would try to find their parents or get them out of the street.
Good. So logic and reasoning is intact. So just a little bit of that memory and pulling direct facts and information. What were those 3 words I told you?
Dog, pillow, and plant.
Okay, so short-term memory also looks okay. That long-term memory you weren't able to do as effectively. Right. So I'm going to set this down, sanitize my hands, and we'll begin with the physical assessment. So Jeremy, the first thing I want to do is just take an overall look. I want to make sure there's no obvious bruises or injuries. Have you fallen and hit your head or hurt yourself in any way in the last few days, few weeks?
No.
Okay. Any changes in personality, in mood, in sleeping?
Not really, no.
Okay, wonderful. So I'll just take a look with my light here. Again, just looking for anything obvious that may affect the cranial nerves. Just turn your head gently for me, please. Just going to look at the other side. Also looking just for any other signs of something not being right, any changes in the hair, discoloration. Feel for some temperature as well. That all seems normal. Any pain when I press around here?
No.
Anything here?
No.
So we'll start out with the eyes. So taking a look at them, look straight ahead for me, please. Just right on that back wall, back there. Very good. I'm going to pull them down. Okay, a little bit of redness. Can you look down for me and look up? And side to side, nice and big, side to side. Test the reflexes in the eyes. So go ahead and close for 3 seconds. Just let them tear again. Let the eyes recover. And when you're ready, open them up and you're going to see a bright light, all right? Reactions are not quite as brisk as we'd expect. Was there some pain or discomfort with that as well?
Maybe a little, yeah.
Okay. I'm going to just shine it right here. So again, just look away from the light. Okay. There is equal reflection in each eye. Do you feel like you can stare at the tip of this pen without discomfort? No double vision here?
No.
Okay. Follow it everywhere it goes. Just don't move your head. Any double vision?
No.
Okay. Can you again look straight out that way? Ignore my pen. Look at the pen and follow it out and follow it in. All right, relax. So there is a little bit of mild nystagmus. And that just means the movements of the eyes are a little bit jumpy. Any dizziness recently?
Not really, no.
Okay. I'll have you read something for me. Do you normally wear glasses?
I'm not to read.
Not to read, okay. So I'm going to point out a couple of words here, and I just want you to read them. What word is that?
Before.
Okay, and that word?
Complete.
And what about this word?
Ironically.
Okay, so your nearsighted vision is perfectly fine there. I'll test your far-sighted vision in just a moment. But I just want to look into the back of your eyes now. And again, this will be a bright light, so it'll be a little uncomfortable. But I'll make it as quick as I can. And just look ahead. I'm going to come in from the side. And that reflex is intact. I'm going to do the same thing on this side. So no issues with the functionality of the back of the eyes. I'm going to test you for some color blindness. So I've got this little book here. And I just want you to tell me, if anything, what do you see?
I see a 7.
Okay. And what about this one?
I don't see anything.
That's excellent. You shouldn't. I want you to, with your finger here, just trace the line from this X to this X using your finger. Very good. So I want to test your vision a little farther away now. So I'm going to go about, I'd say about 5 feet. Does it seem about 5 feet to you?
Mm-hmm.
Okay. Can you read this line right here?
D, H, J, B, S.
Okay, cover one eye and read it backwards for me.
S, B, J, H, S.
Okay, and cover the other eye and read it forwards for me.
G, H, J, B, S.
Okay, so again, a couple misses there, but you did mention you wear corrective lenses. Is that for distance?
Yeah, it is.
Okay, so that makes sense. Go ahead and cover one of your eyes with this card. I'm going to stand right about here. So can you see my nose?
Yeah.
Okay. I want you to keep staring at my nose, but tell me when you see my fingers wiggling, okay?
I see him wiggling.
Keep looking at my nose.
I see him wiggling.
Okay.
Wiggling. See him wiggling.
Okay, switch eyes for me, please.
I see him wiggling.
Keep looking right here, okay?
I see him. I see him.
Okay. So a little bit of delay on the field of vision for the peripheral. So I'm going to move on now, past your eyes into the nose area. So I'm going to be checking your smelling, but first let's just take a look at the nose itself. Just sanitizing my equipment. Okay, so just tilt your head back for me, Jeremy. Take a look inside. Do you see a little bit of redness and swelling? That side looks okay. Tilt your head down. Can you breathe in for me? Definitely more patency on that one side. I'm going to give you a few things to smell. First, can you just put your wrist out for me? I'm just going to be rolling them on your skin and have you smell them. So I'm going to generously apply this. I want you to hold that up to your nose and tell me what you smell.
I think cinnamon.
Okay. It's supposed to be something floral. That's lavender, I think. So that's not quite what we would expect as a finding. Let's try another one. Let me sanitize the other side. Try this one now. And these are very, very potent smells, so you should be able to smell quite a bit of it.
Chocolate.
Okay. That was supposed to be coffee, so that is a bit unusual, and I do want to just note that in your chart because that finding is, again, not as expected. No other pain in the nose, though?
No.
Okay. Take a look in the ears now. Start out on this side, so just turn your head for me, please. A little bit of wax buildup, but no redness, nothing unusual. Same thing on that side. Nothing out of the ordinary. No unusual colors or swelling that I wouldn't expect. So I'm going to test your hearing. I'm going to first just whisper something covering up one ear. So I'll cover up this side and I'll whisper in this ear and I want you to repeat after me, okay? 2, 6, 9.
2, 6, 9.
Yep, that's very good. And on this side, G, L, F.
PLF.
Okay, very, very close, but there was a little bit of hearing disturbance there. So let's do some further testing. So to start out, just got a little bit of wrap here in the office. Just makes a little bit of a noise like that, okay?
Mm-hmm.
Close your eyes and just tell me which side you hear it on.
The left side. The right side.
Okay.
The right side again. And that's the right side. Left side.
Okay.
Left side. Left side.
Okay. So definitely some issues with the hearing, which side you're hearing it on. I'm going to hit this tuning fork. I want you to tell me which side you hear it on, left, right, or both, equally.
Left.
Okay, I'm going to try it one more time. Again, left, right, or both?
Both.
Okay. So it seems like that was, again, a little bit of a mixed result test. I'm just going to do one more thing. I'm going to make just a little tapping sound. I just want you to tell me left, right, or both, okay?
Okay. Right. Both.
Okay.
Left. Left. Both.
Okay. Again, some inconsistencies there. And I think that would warrant a truly in-depth hearing test. Let's take a look into the mouth now. You can just open up and say ah for me. Okay, good. Functionality there is good. Just stick out your tongue for me. Okay, and lift it up onto the roof of your mouth. Yep, exactly. And side to side. And the other side, very good. Okay, can you stick it out and do that? Stick it out, move it side, side. Okay, and you can put it back in your mouth, symmetrical there, that's very good. Can you push it into my hand here? Okay, strength's a little bit weaker than I would expect. Same thing on that side. Can you push down against, with your jaw, like that? Okay, that's nice and strong though. Can you clench your teeth? And here, and open and close. A little bit of clicking there. Is that normal for you?
So.
Okay. So far, the strength in the mouth is generally okay. A little bit less in the tongue than I'd expect, but not beyond the normal scales. Can you push down against my hand as hard as you can? Okay, and back. Okay, to the right here. And the other side, and down to the shoulder, and this side. Alright, that's all 5 out of 5. So you did really well there. Can you shrug your shoulders for me as hard as you can? As hard as you can. Okay, and relax, and arms up, and push me away. Push me, and pull me towards you. Okay, yeah, a little bit less strength than I'd expect there as well. I'd say about a 3 to 4 out of 5. So I just want to move the muscles because of that. Just check the tone in the muscles, and just relax completely for me. Side. And that feels fine. No real rigidity. And take some measurements now. Okay. I'm just going to get from here. I'm just looking that these are all within the normal cephalic range. And so far that they are. Check a little bit more for symmetry. Can you open your eyes as high as you can? Don't let me push them down. Okay. And can you close them really, really tight? Very good. Can you smile for me? And frown. Okay. And just puff your cheeks out and hold them there. Okay. Just a little, again, a little bit of less strength in the face than I'd expect. And that's probably that same nerve, that facial nerve, to do with the tongue. Let's test some of your sensation. So, and just have this little bit of paper here. I just want you to say yes when you feel it, okay?
Yes. 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 Yes.
Feel that?
No.
If I go a little harder.
Yeah, about that one.
Okay, let's check a couple other spaces right here.
Yeah. Yes.
Okay.
Yes. Yes.
Okay. So a little bit of sensation loss in that right cheek. Let's continue to test that. So I'm going to have a little bit of a pokey tool. So if you give me your hand, sort of sharp like that.
Mm-hmm.
And I'm just going to grab a tissue from over here for the soft. So there's going to be a difference of this versus that.
Mm-hmm.
And I want you to tell me sharp or dull, and I want to make sure you can differentiate between the two, okay?
Okay. Dull. Sharp. Dull. Sharp. Dull. Dull. Sharp.
Okay.
Sharp. Dull. 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 Sharp. Dull. Dull.
Okay, so again, a little bit of isolation there in that right cheek. Have you had any tingling or numbness in that side of your face?
Not that I've noticed.
Okay. I'm thinking it probably is more of a surface issue just because you had full symmetry, strength, and use of the face. A little bit of weakness in that jawline, but or the tongue and the cheeks, but I'm surprised it's up here. That to me, just because it's such a small area.
Mm-hmm.
Okay. Let me see. Does this feel cold here?
Yeah, it does.
Does it feel as cold here or colder here?
Maybe colder.
Colder than here.
Mm-hmm. Oh, yeah.
Okay. What about here? Does this feel the same as that?
Mm-hmm.
Okay. And this as this?
Mm-hmm.
Do you feel this buzzing there?
No.
Okay. What about here? You feel that buzzing?
Mm-hmm.
And you feel it buzzing here?
Mm-hmm.
And here?
Yeah.
Okay, so it's again just that small area. Any burns, scrapes, anything like that there recently, even if it's healed now?
No.
Just a couple more little things left for you, Jeremy. We're almost done. I want you to close your eyes. I'll start out by just putting something into your hand here, and you can just feel around and try and tell me what that is.
I'm not entirely sure.
Okay. I'll try something a little bit more typical. So, again, with that hand, tell me what that is.
It seems like a pen.
Yep. And the other hand, I'm going to give you something. What does that feel like?
That's the same thing.
Okay. And which is a?
A pen.
Okay. So that is good. The first thing I gave you was sunglasses. They can be a little bit more tricky for the fine motor skills, but since you were able to feel that pen, again, not too worried. I'll just have your finger now, please. And I'm going to, the other one, please. I'm going to move it up like this or down like that. Just tell me if you feel up or down.
Up. Up. Down.
Good. And the other side, I'm just going to do it with this one now.
Down. Up. Up.
Very good. Just with this hand, just you feel the difference between that 1 point and 2 points.
Mm-hmm.
Tell me what you feel.
1, 2, 2, 1.
Okay, what number am I drawing in your hand?
3,
Okay, and what about now?
1.
And add those together, what number do you get?
4.
Let's see the other side.
2, 2, 1, 1.
Okay, and what is this letter?
L.
Okay. So again, that sensation loss on that right side of your face is a little concerning. However, it does not seem to be neurologically impacting the rest of your body. Can you do this for me? Just really slow. Okay. And what about on your back and forth? And lift your arms up, put them out nice and straight. Can you close your eyes and flip them over? Okay, relax. Yep, well that's fine. That's great news. Just your reflexes and then you're all set today, Jeremy. So I just want you to relax for me in my arm. Not too reactive there. That's better. Okay. And coming around to this side. And again, relax fully for me. Same level of reactivity, which is actually good if there's low reactivity, but it's bilateral. Okay, keep looking straight ahead. And this side. Okay. So, there were a few things, Jeremy, that you did miss on the exam, and I am a little bit concerned about that I think warrant further testing. My suggestion is we do a real in-depth exam, maybe in about 3 weeks, to see if there's any changes, if anything worsens, because it could simply be that, you slept on that funny, and it's a little tingly today, and you're not feeling 100%, but there were enough issues we had in all parts, especially with the hearing as well, that I think it warrants further testing, okay?
Okay.
Any questions for me today?
No, I don't think so.
All right. Well, I hope you feel better soon, and thank you so much for your time.
Thank you.